Namaste students, I am Dr. Komal Rathore, Assistant Professor, Department of Kamarbhritya, Faculty of Ayurvedic Science at JAYOTI VIDYAPEETH Women's University, Jaipur, Rajasthan. Students, today we will discuss about developmental pediatrics and milestone of the children. So let's start. So why should we assess? Why should we assess developmental parameters of the children? So it is to reassure parents and early diagnosis and management of disability, feedback for obstetrician and neonatologist, and prevention in next sibling. So what to do now? So just passively observe his play and spontaneous activity. Use TDSC to screen. TDSC, I will describe what is it. Go little more deeper with developmental chart and need not memorize. Keep the chart over the table and assess. And what is the table? I will tell you. So firstly, 4 aspects of development. First, we can assess development for 4 aspects. First is motor development, fine movement, hearing and speech, and fourth is social behavior. So motor is that motor development for body posture and large movement, fine movement, vision and manipulative skill. Third is hearing and speech, and fourth is social behavior and spontaneous play. So development assessment is the most conveniently divided into 4 fields. 4 fields: motor, fine movement, hearing and speech, and social behavior. Here is the Trivandrum Developmental Screening Chart, TDSC, which I will previously told. So TDSC, Trivandrum Development Screening Chart, is first is point two part of doll, means 3 parts: walking upstairs with help, and walk backward and say 2 words, walk alone, throw ball, walk with help, and it is many words. It arises from 1 month to 24 months. It is for 2 years. So it is the chart, and in first month to third month, social smile children's give. 2 month or 2 month or 1.5 month to 3 month, eyes follow pen and pencil and hold hand and steady. So it is the step by step, and every month up to 24 months, children's developmental screening chart given by Trivandrum. So next is it is developmental scale. It is very important developmental scale for gross movement, fine motor movement, language, and social behavior. So what is gross movement in 4 to 6 weeks, and 3 months, 6 months, and 9 months. So it is important, and it's keep in mind. So it's charts keep assess on your table, and according to table inspect your children. So it is important. Gross motor 4 to 6 weeks, supinely, head on side, wrenching hand closingly, thumb and pulled and sitting, head movemently, erect and fall. So it is important. So it's keep in mind. So next, here is developmental milestone, age and milestone. So developmental milestone is 1 month, raise hand slightly when prone, and alert to sound, regard face movement and extremities equally. 2 to 3 months, smile, hold up, choose reaches for familial object, recognize parent, and 4 to 5th one, rolling front to back, back to front, and sit well when propped, laugh, orient to voice, enjoy looking around, grabs, rattle, bear some weight on legs. In 6 months, sits unsupportedly, passes cube hand to hand, bubbles, and use racking grabs, feeds self crackers. And 8 to 9 months, crawling cruiser, pull to hand, pincer grabs, play pat a cake, feed self with bottle, without support, explore environmental. And 12 month, walking, talking, few words, understood, no, say, mama, dada, indiscriminately throw objects, uh, imitates action, mark with crayon, drink from a cup. So it is the many more things up to 3 years and 4 years. So what is the prevalence? Prevalence is low frequency and high morbidity. So low frequency and high morbidity cases is cerebral palsy, visual and hearing impairment, autism and mental retardation. So it is the low frequency and high morbidity. And high frequency, low morbidity is learning disability and ADHD. So it is important. Clinical presentation is early infancy. It is poor abdomen tone and lack of response to auditory and visual stimuli. Late infancy, like motor delay, and second and third year language and behavioral abnormalities. So it is important. And school entry, children got ADHD and learning disability. 3 parts of assessment. First is history, medically and social history has to be taken, examination, general and CNS examination, and developmental screening. So what is the history? History is, first of all, risk factor. Means children's delivery is prematurity or mature, advice perinatal events and family history. Warning sign is mother suspicion, inattention to sound, and developmental history is tracking of milestones. And what is the physical examination? So physical examinations has first is growth parameters, congenital abnormalities, anomalies, skin finding, eyes finding, abnormal faces, and organomegaly. So physical examination is must and most important. Neurological examinations are first is classifications, classical, and second is extended examination. So extended examinations is symmetry, quality of movement, primitive reflexes, and postural response. So it is important extended examination for symmetry, quality of movement, primitive reflexes, and postural response. Now it is the Caesar's leg. It is very important. Caesar legs, they are unable to stand up on their feet. So order to testing is developmental examination prior to PE. And language, social, fine and gross motor is spent sometimes in making friendship. Just observe him while he plays. Do quickly and efficiently. Primitive reflexes, persistence beyond this is abnormal. So palmar graphs, 3 to 4 months. If beyond this periods it is present, so it is abnormal. So palmar graphs response is 3 to 4 months. Moro is for 5 months. Asymmetrical tronic reflex for 6 months, and plantar graphs reflex is 9 to 12 months. Testing vision 1 month, fixing on mother face. 2 month, follow object at 90 centimeter through 90-degree angle. At 3 month, through 180 degree. 10 month, pick up resin. And 1 year, pick up hundreds and thousands. 2 to 3 year, miniature toy at 9 feet. And 3 to 5 year, stake our matching letter. And more than 5 year, Sanelin chart. So newborn, ventral suspension, and 6 month, newborn ventral suspension, and 18-week head held up, and 6-week head is same plane, and 12-week floppy child. So it is in cerebral palsy. 4th week complete head legs and lifting head up slightly. In 2 month partial head legs, and 4 month no head leg. 6 week chin off couch intermittently, and 24 month hand support, and 10 to 12 month forearm support. So it is the milestone. And 10 to 20 week hang regarded. 44 week creeping position, and 52 week bear walk. 6 month immature grasp, 8 month intermittent grasp, and 1 year mature grasp. 10 month index finger approach, and 10 month also pincer grasp. That is the palmar grasp reflex. Started from 3 week. Palmar grasp reflex. 4th week rooting reflex. 4th week also in visual tracking. 6th week concentrate on rattle. Beginning of eye hand coordinations perform. At 6th week social smile. 4th month had control, eye contact, and good interactions with the others or parent. At 4 month holding hand, looking further away. At 5th month palmar grasp and biting the rattle. 5th month reaching out for rattle. 6th month bearing weight on leg. At 6th month holding and exploring rattle. At 6th month turning to sound of rattle. 6 months sitting without support, examination the mat. And 7 months sits steadily. 10 month finding hidden objects. At 1 year, examination the soap box with interest, household object can be used. At 1 month, communicating the gesture, mother hold out hand and baby gives the toys. At up to 1 year, walking with broad bases in response to mother's call. And 1 year also making gesture of communicate pointing the leaf. So interpretation is give allowance for prematurity, fatigue, illness, and familial pattern. If in doubt, repeat later. So remember, wide range of normal diversion. So after developmental examination, is there any delay? Can it be normal variant? Is it global delay or dissociation between field? If not defined, can I decide after repeat the test? So normal variant is language perception is well advanced than expression. Some do bear walk and some bounce around floor, and some do side stroke, crawl and backward and roll. Some never crawl, so they stand and walk. So it is a normal variant. So what is the causes of motor delay? It is very important to ask, and it is more important to inspect personally. So what is the cause of motor delay? So first is normal and familiar variation, bottom shuffling, and it may be chronic illness, cerebral palsy may be there, and neuromuscular disease like DMD and SMA. Orthopedic changes, maybe it is rickets and emotional neglect. And here is some warning signals in language development is risk of deafness, mother suspicion, and there is no response to everyday sound, no repetitive bubbles by 10 months, no words by 21 months, and not putting 2 to 3 words together by 2.5 years. So it is important to identify that warming or alarming sign in language development. So language delay is reception is well advanced than expression. So here is language delay for hearing defect, familiar or genetic defect, global delay, if it may be autism or mental retardation, or it is the environmental reasons. So global delay causes, one of the most important cause of global delay is chromosomal defect, and it may be some syndromes. It is important for cerebral palsy, structural brain defect. It may be instrumental delivery or Ventures delivery. So here some defect in brain, and there is not proper reaches oxygen from their brain. So some structural brain defect may be there. So neurometabolism or neurometabolic problem are there, and postnatal causes may be there. So global delay, it may be considered very carefully. So factor affecting development may be, it may be some causes like genetic, physical, nutritional factor, emotional and socio-cultural defect, and neurological defect. So first is developmental assessment scale. It is very important. I told you before, Trivandrum developmental screening chart. It is very important and it's a authentic developmental chart. And then thereafter, Denver development chart. It's very important. So next is bone age. Bone age, at birth up to 4 months, knee and hips formation may be there, and 4 to 12 months shoulder, and 1 to 10 year wrist, and more than 8 to 14 year elbow. So left side bone are assessed. So decision is abnormal, probably normal, doubtful, and normal. So see again, if there may be some problem, then you can use milestone development chart, and from that chart you can assess your child milestone. So it is very important to assess. So that's all for this session. Hope you like this session. If you have any doubt or any query, you can ask me in further session. I will definitely resolve your problem. So that's all for this session. Maybe it is helpful and it is understanding to you. So that's all for now. Thank you. Thank you so much.